Dietary Supplements, The Need for Change. Presented by Kathy Lee, Willa Knuckles, Prudence Lewis, and Jaden Lempier.
What is important to know about dietary supplement? The abuse and the need for policy change. The Dietary Supplement and Education Act, also known as the DSHEA of 1994, was passed by former President Bill Clinton. Over 15% of Americans will use a dietary supplement for weight loss in the United States per year. 2/3 of Americans are overweight or obese, and 67% of those individuals will use a dietary supplement to lose weight. The dietary supplement market is a billion-dollar industry. $2.1 billion, or $6.50 per person in the United States, are spent a year on weight loss dietary supplements in just the pill form. Despite it being over 25 years since the passing of the DSHEA, there is still no global consensus on what is legal and lawful and what ingredients should have a permanent ban. Currently, there is over 1,050 tainted products on the FDA list of dietary supplements, and thousands more are tested yearly. Supplements marketed for weight loss or athletic performance often contain compound structures similar to those of amphetamine. What type of prevention is needed for this campaign? Primary and tertiary prevention is needed. Primary prevention involves informing the individual of the potential adverse reactions involved with the misuse of dietary supplements for weight loss. This includes seeking proper advisement from healthcare provider prior to the beginning of the use of dietary supplements for weight loss. Several medications cannot be taken with popular over-the-counter supplements for weight loss. Nutritional-based classes that promote healthy cooking can also be implemented on a community-wide level. Tertiary prevention includes advocating for stricter dietary supplement laws, petitioning for universal definition of what products should be legal and banned. Also, it is referring individuals to healthcare providers for guidance on healthy weight loss options. Social determinants of health. For an individual to be considered overweight, their BMI must be over 25.0. For a person to be considered obese, their BMI has to be above 30.0, according to the CDC. Women consume dietary supplements at a higher rate than men for weight loss. Men are more likely to use dietary supplements for performance enhancement. Women who live in urban regions, have higher education, and live in higher economic status consume dietary supplements at a higher rate than those in lower economic status. Married women who smoke have the highest rate of dietary supplement consumption as those compared to the healthy counterparts.
The theoretical models that we chose for a health issue were the trans-theoretical model and the health belief model. The trans-theoretical model relies on distinct stages to show health behavior changes. These are pre-contemplation, contemplation, preparation, action, and maintenance. It also involves social cognitive theory, which we will talk about more as it applies to our health issue. The health belief model was chosen as it explains individual health behaviors. This was one of the earliest models that they created. They are different beliefs that stimulate the behavior change, involving susceptibility, severity, effectiveness, self-efficacy, and costs. With our health issue being diet pill abuse, we thought the trans-theoretical model would be a good health framework as it's used for addiction and abuse problems. The social cognitive theory uses the internal and external factors of a person to help encourage them to change their behavior. This can be things such as informing them about their decisions or having community support groups that offer them alternative methods to their health issue or treatment plans. One of the other things that this model uses is perceptions to help create change. If we present the facts the way that they are, and then they're able to perceive the actual threat, and they're able to contemplate the decision of why they're doing it, it encourages the health behavior to change and to be more effective.
Health belief model. This model is also known as cognitive model theory. This theory explains how an adult chooses to use a shortcut to stay or become healthy. One will choose to use dietary supplements instead of eating healthy and exercise, while others engage in unhealthy activities like smoking, alcohol use, and continue to smoke. 6 components of health belief model are perceiving severity, susceptibility, benefit barrier, cues to action, and self-efficacy. Performing SWOT analysis on this project brought up about few observations. Strength was access to education material. Weakness observed was timing to implement changes. Doctors and dietitians have an opportunity to advertise against minimal use of dietary supplements. The threat are fake supplements and false advertisement on dietary supplements. Logical mode points out misinformation on dietary supplements. This will help to provide structured framework for better understanding on the impact and strategies. Incorrect use of dietary supplements causing health issues outlines the input, activities, and outcome that is necessary to address and mitigate the misuse of dietary supplements. Intervention objectives. Intervention objectives are aiming to educate and advocate. Over 15% Americans use dietary supplement per year. More vital information needed on dietary supplements, drugs, and better policies and regulations. Increase awareness of potential health risk by providing education on adverse reaction and drug-to-drug interactions.
There are plenty of different strategies and activities that can be used to address abuse of dietary supplements, such as policy and regulation advocacy, individualized nutritional assessments, and education and awareness campaigns. There are many different methods to approach responsible dietary supplement usage. A couple of methods would be educational methods, regulatory and policy based methods, and community based methods. Educational methods can include workshops where healthcare professionals would conduct sessions that focuses on the proper use of dietary supplements. This is where dietary supplement users can ask any questions about dietary supplements. Regulatory and policy-based methods could include advocacy for policy changes where groups would work with governmental health agencies to push out for a stronger regulation of supplement marketing. This can include an improvement of labeling that consists of dosage recommendations and potential risks of overusing. Community-based methods would be where advocacy groups can host events with the collaboration of health organizations where individuals can receive free assessments and personal advice on supplement use. At these events, community leaders can educate people about safe supplemental practices and the potential risks of overuse. Using the health based model can improve individuals' engagement in health promoting behaviors where they will understand the severity of the issue and believe taking action will reduce the risk. In the context of dietary supplement overuse, this model will assist individuals with recognizing the potential risks and the benefits of practicing responsible use of supplements. It would provide a clear pathway for behavior change, such as misinformation and supplement use. In the theoretical model, this theory would help shape education components by addressing attitudes towards supplements, influences from society, and the individual's sense of control over the supplement use. This would directly target intentions of the individual's supplement usage. Although there are many strengths that come from the health-based and theoretical models, there are weaknesses that also follow these two models. Since the health-based model is based on how people will make a decision on their health after weighing the risks and benefits, people can still be influenced by emotional factors, social pressures, or misinformation. People can ignore warnings by their influences. The theoretical based model assumes that an individual's behavior would change and that they will follow through with the new behavior. Some people will revert back to the overuse of dietary supplements from habit, social pressure, and lack of health care advice. The overuse of dietary supplements within a health-based model can lead to unintended risks for a person's overall health. Although supplements are designed to promote a balanced diet, the overuse of the supplements can cause imbalances in nutrients, interaction with medications, or even be toxic to the person's overall health. The idea of supplements substituting a health diet could cause a neglect of essential nutrients that are typically absorbed through natural resources. Health is related to the person's lifestyle, such as proper diet and exercise. In the long term, it's important for a person to maintain a sustainable habit. With the theoretical model, the overuse of dietary supplements can cause misunderstanding of nutrition and overall wellness. The model can cause confusion by overemphasizing the role of isolated nutrients, leaving a person prioritizing supplements over comprehensive dietary practices. Due to this misunderstanding, it could lead to a false sense of security where a person will think that supplements alone are sufficient in meeting their nutritional needs.